Hi, I'm Dr Ranj, and in this short film, I'm going to talk you through some advice on what to look out for when you think your child has croup, as well as where to go to get help. This film is based on information from the Healthier Together website, which provides lots more advice on croup and other childhood illnesses. It's really important that you get help when you need it to make sure your child is given the right care and treatment. So we're going to divide the things to look out for and what to do into red, amber and green categories. The first category I'm going to talk through is red. If you notice these symptoms, then get urgent help, either through your nearest emergency department or by phoning 999. If your child has any of the following: blue lips, pauses in their breathing, an irregular breathing pattern or something called grunting. There we go. They're making a harsh noise as they breathe in, which is there all of the time, even when they're not upset. They're too breathless to talk, feed, eat or drink. They look pale, mottled and feel really cold to touch. They're so upset that nothing you do helps. They're confused or very sleepy and difficult to wake up. Or they have a rash that doesn't go away when you press on it or use the glass test. Then you need to get urgent help by going to the nearest hospital emergency department or phoning 999. The next set of symptoms are the amber symptoms. For these, we advise that you get help on the day they start, but you probably don't need urgent help. So you should call your GP or NHS 111. If your child has any of the following: laboured or fast breathing, or they're working hard to breathe, for example, drawing in the muscles below their lower rib cage, at their neck or between their ribs. Making a harsh noise as they breathe in, but this is only present when they're upset. Have not had a wee or wet nappy for 12 hours if over 3 months old, or 8 hours if they're under 3 months old. Extreme shivering or complaints of muscle pain. They're drowsy and are very sleepy, or seem so upset that you're unable to settle them with toys, TV, food or cuddling, especially if they remain very sleepy or very upset despite any temperature coming down. They are 3 to 6 months old, with a temperature of 39 degrees centigrade or 102.2 degrees Fahrenheit or above. Please remember, a temperature is common in babies up to 2 days after vaccinations, and if the temperature doesn't come down with paracetamol after a vaccination, then call the NHS 111. They continue to have a fever of 38 degrees centigrade or above for more than 5 days. Or they are getting worse, or if you're worried. Then you need to contact your GP today and make an urgent appointment or call NHS 111. If they develop any red symptoms while you're waiting, you will need to call 999 or go to your emergency department. If your child has none of the red or amber symptoms, then they fall into the green category, which means they probably don't need urgent or immediate help. However, if you are worried, you can contact your GP, pharmacist, health visitor, or call NHS 111 for advice. If your child does develop any red or amber symptoms, follow the advice offered earlier in this film.